Hello, my name is Sarah Tovar, and I am in the Psychiatric Mental Health Nurse Practitioner program. And I'm going to talk to you today about my proposed project, and it is for implementation of cognitive behavior therapy for treatment of insomnia with individuals who are diagnosed with bipolar disorder. So, first, we need to talk about bipolar disorder, which is a serious mental illness that affects millions of people, and it causes unusual shifts in mood, energy, activity, and it gives them the inability to carry out daily tasks. Common symptoms of bipolar disorder are insomnia, hypoinsomnia, and hyperinsomnia. There is no cure for bipolar disorder, so currently the method of treatment is management of symptoms, and it is a lifelong management. A combination of interventions are necessary, not only pharmacological but also psychological, and that's why we're bringing in the cognitive behavior therapy. Insomnia in itself is a significant health problem affecting 35 to 50% of the general adult population. So not only is it affecting those with mental illness, it's affecting the general population. Unfortunately, in bipolar disorder, insomnia has a little more severe effect, whereas it will exacerbate the other symptoms of bipolar disorder. Cognitive behavior therapy can effectively manage insomnia, reducing symptoms of bipolar disorder. Harvey, 2015, found that cognitive CBT, we'll call it CBT, is effective in reducing mood relapse and increasing sleep outcomes. Ritterband, 2017, determined web-based CBT was effective in improving insomnia. And Kaplan and Harvey revealed that CBT is a good treatment option for insomnia. And finally, Ellis, 2015, those results indicate that a single treatment of cognitive behavior therapy actually improves sleep outcomes. They actually called it a one-shot treatment. So for this project, we're going to recruit volunteer team members, and we'll do this by presenting a PowerPoint presentation in the staff meetings or monthly management meetings, explaining in detail what the sessions are going to consist of and what the treatment outcomes objectives are, and then giving the staff members the opportunity to volunteer to participate as team members, and this will also cut down on cost. The setting will be at Lincoln Trail Behavior Health, also making it easier for the team members because they'll already be there at their workplace. They won't have to travel anywhere else. We will recruit 20 participants ages 18 to 60 with a diagnosis of bipolar disorder, and they have to be had a stable medication regimen for the past 4 weeks. So we'll talk a little bit about let me tell you about the exclusion first. Participants cannot have alcohol or substance dependency within the past 3 months, cannot have sleep apnea, no current suicidal ideation or homicidal ideation, no pregnancy or current breastfeeding, or no overnight shift working for the past 3 months. So once the participants are deemed eligible, they will sign an informed consent form. So then the treatment will include 10 sessions. Session 1 is going to be the baseline assessment, and it's going to include a questionnaire to evaluate where the individual is right now with their sleep patterns. Goal setting will also be initiated in this baseline assessment. Sleep and circadian education will be provided, and an explanation of the appropriate use of the tools that the participants are going to be asked to evaluate their sleep and mood, and that is the Insomnia Severity Index. We'll talk about that in a minute, and the Brief Mood Introspection Scale. So this is going to measure their sleep and mood that they will be self-assessing. So after that baseline assessment, the next 2 to 9 sessions, actually sessions 2 through 9, will consist of a structured agenda and homework assignments. And what will be included in those sessions is first a behavior module. Now that behavior module is going to be basically things that the individual can change behavior-wise. For example, stimulus control, scheduled wake, sleep, and exercise times, sleep restriction during non-scheduled time, so there will be no napping. If scheduled bedtime is 10 o'clock, the individual waits till 10 o'clock to go to sleep. And then also a relaxed time will be initiated 30 to 60 minutes before the scheduled sleep time. And then we'll move to the cognitive module, which that's where we go into altering negative beliefs about sleep, reducing the bedtime anxiety and worry, and then identifying energy generating effects of anxiety. So for the individual to realize that this anxiety makes them, or this energy makes them more anxious, will make them want to initiate and implement the cognitive behavior therapy to get the desired outcomes. And then finally, session 10 will be a follow-up at 6 months to evaluate the effectiveness of the treatment. And they can continue with this cognitive behavior therapy, or they can decide to try something else, but that's what we will do at the follow-up. So the objectives for this project is to determine the effectiveness of CBT for treatment of insomnia with patients diagnosed with bipolar disorder. So our desired outcomes, of course, is going to be improved sleep and mood. And then a relative outcome to that would be the reduced psychological stress for the individual through awareness of negative interpretations and development of alternate thinking patterns. So basically realizing what those thoughts do and changing thoughts to change behavior. So there's a little graph you'll notice on the poster board there that kind of starts at the beginning negative, it will never happen. In the middle is the realistic, it could happen. And then at the end, positive, it will happen. So it's just kind of giving you an idea of how thoughts can change behaviors and outcomes. So our outcome measures are going to be, as I talked about a minute ago, the Insomnia Severity Index Scale, and that, we call it the ISI, and that is scored, a 0 to 7 is no insomnia, which of course is the desired score, 8 to 14 is subthreshold, 15 to 21 is moderate, which is probably where most people will be at baseline, and then 22 to 28 is severe. Now, the Brief Mood Introspection Scale, the BMIS, it is a self-assessment that the individuals will do up to 3 times a day, which will be set in the goal-setting phase. 10 equals very pleasant. Negative 10, all the way to negative 10 is very unpleasant, and then the 0 would be neutral. Sorry, I'm running out of time here. So in conclusion, insomnia is associated with a decreased quality of life, and it's linked to mood relapse and bipolar disorder. Advanced nursing practice must consider the need for a variety of treatment options for individuals with bipolar disorder, and CBT is one option that can effectively treat insomnia, which will result in the reduction of BD symptoms. So thank you for listening to me today, and I hope you all have a good holiday.